A leading cause of death in Australia, with a warning, an alarming number of people are falling victim to the disease. It's prompted fresh calls to mask up as we head into winter to reduce the strain on the state's health system and save lives. For more on this, let's bring in Victoria's AMA President, Dr Roderick McRae. Doctor, good afternoon. Now, would you support the return of masks?
Look, I've encouraged the voluntary use of masks for several months now. It's a very simple, non-pharmacological mechanism of just reducing the transmission of not one but two highly infectious respiratory viruses that are really, really distressing our ability to look after people in the public health system.
OK, so that's masks. Is there anything else we should be doing to stop the spread of COVID as we head into winter?
Yes, it's a nasty disease and winter appears to have started a few hours ago. All of the simple mechanisms, we've been hearing about them for about 2 years. It's minimise your movement because that's how the virus transmits. Do simple things, sneeze correctly, cough into your sleeve or your lapel jacket, the mask wearing, and get vaccinated. All of these things do so much for each of us as an individual to help ameliorate the stresses on the healthcare system.
We're hearing about the numbers of deaths every day, but who is actually dying? Is it the elderly or is it the young too? What's the spread?
It's indeed a remarkable spread, so basically all ages from start to finish. We also have the influenza A virus zipping around Melbourne as well, and that's predominantly affecting the younger age groups, so neonates, toddlers, preschoolers, and of course it's just going around classrooms and the staff associated there. There's a higher number of elderly patients succumbing as a consequence of COVID-19 infection, but it's not an absolute rule. And of course, if we were to have an elite athlete die of COVID-19 in their 20s or 30s, we'd hear all about it.
What about those who were double vaxxed but not boosted? How at risk are they now?
Well, look, the clear medical advice is that they're highly at risk. So we use this language that says fully vaccinated, but that was long ago and against different variants. Through calendar 2022, that's the last 5 months, it's predominantly the Omicron variant. And despite people reporting that it doesn't give such a severe illness, it's actually killed more Victorians and more Australians in this 5 months than in the preceding 2 years. People really need to be alert to the fact that the virus is not away, has not gone anywhere, absolutely